medical practitioner, a gerontologist, nutritionist, and a health educator based here in the Woolwich Arsenal, London in the UK. And today's topic is enlarged liver. Enlarged liver, medical term is hepatomegaly. That's what we're going to talk about. We have to have the understanding what is enlarged liver. We will look at the signs and symptoms. What actually happens when a person has enlarged liver? We will look at that. We'll look at the causes and then the risk factors. When I talk about risk factors, what it means is that who actually gets it. We'll look into that tonight. So thanks a lot once again for joining me. So let's have an overview now, or a general understanding of enlarged liver. So when we say a liver is enlarged, it simply means that it is a liver that is a bit bigger than the normal size because of any reason. Any reason can lead to enlarged liver. We'll look at those reasons very soon. Now, the medical term, those that are interested, if you go to hospital and then you were told that you got a hepatomegaly, you shouldn't, be anxious. It's just simply the liver that is enlarged is bigger than normal. Nothing just happened. Something has caused the liver definitely to enlarge. And we'll be looking into that. So, an enlarged liver is a symptom of an underlying problem, a health or medical condition. So enlarged liver itself is not a disease. It's a symptom on its own. But the symptoms may come if there are some underlying health conditions affecting the liver actually. So an enlarged liver may occur or may happen along with other symptoms depending on the underlying disease that is causing that enlarged liver. So your liver is the largest internal organ, right? Is the largest internal organ. And the size is like a football size shape on the right side. And the size actually depends on the age. The sex, when I talk about sex, it means the male or female. And it also depends on the body structure, the size of your liver. And the liver is so amazing. You see, the liver digests your fat. It stores sugar. Whatever you eat, it ends up sugar. It ends up glucose. And the liver stores it in the form of glycogen. That is the form. And whenever you need some extra glucose for your energy, the liver will convert this glycogen into that glucose for you to have the energy you need. And the liver fights off infections. So the liver is so important in our immune system. So amazing. So if your liver is stagnant, it means that it's not active as it should be. Then your immune system automatically drops. That is when individuals have infections, often cold, and they can catch cold, and the cold or the flu can last for weeks and weeks, sometimes months, because the immune system is low, because their liver is not active. If you have an active liver that is working, I'll tell you, your immune system will be well tuned, working beautifully. Now, the liver produces proteins and hormones, right? The liver controls your blood clotting, and the liver controls cholesterol. Actually, the liver produces 85% of your body cholesterol needs. 85%. That is why cholesterol can never be a disease that you should take medicine for. If you have high cholesterol, it can mean that, or it may mean that you have inflammatory condition in your body. This will actually trigger more production of cholesterol by your liver. 15% may come just from food. If you have a healthy eating habit, then you're going to have a healthy cholesterol getting into your body. Just take note, cholesterol is not a major issue. Our brain is 70% fat. The body needs fat. The body needs cholesterol. It's part of the it's a protective substance. This is the truth of the matter. So if you go to hospital and you're told you got a high cholesterol, well, you got to find out what is causing it to go high. That is what you got to find out. Not to only take medicine straight for the cholesterol to reduce it. Take note of that. Right. Now, another major function of the liver is to break down toxins, poisons that goes into our medications. You see, we have toxins that goes into the body through the food we eat, medications we take, the environmental toxins, and the liver is the main filtration organ that filters blood. And that is why it's so important for us to purify or cleanse the organ system from time to time, but especially the liver. If I ask you, when did you last cleanse or purify the liver? Some individuals will say, "Doctor, I have no idea even how the liver is cleansed or is purified. Does it mean I have to take some lemon and in warm water?" Well, it's quite helpful, but it wouldn't do the job for you. It's supportive, but we have ways, we have herbs, and we have therapies that can cleanse your liver. So your liver will be active, because the quality of health and the quality of life depends on this organ. That is why I'm talking about the liver as the first topic for this year, because the motto for this year, for this company that we're running, is quality of health translating into quality of life. You see, the liver actually, it is the only organ in the body that is regenerative. When I talk that an organ is regenerative, it means that when you cut about 75% of the liver and throw it away because it has some problems, you throw it away, it will regenerate within good period of time as you support the body in general. If you cut part of your liver and give it to somebody, that's the liver transplant, that part of the liver that has been cut off will regenerate into a full liver size in that person, and yours will also regenerate. It will grow back. It's the only organ in the body that can regenerate, and that is why we got to take care of the liver. It's so important. Now, what happens when you have an enlarged liver? What happens? Now, if you have an enlarged liver, it could mean you have a liver disease. There are several diseases that affect the liver. We'll be looking into that. So it can mean that. It can also mean that you, as that individual with enlarged liver, may have cancer. Right, but it's not common. Beloveds, it's not too common that to have leukemia. It's quite a frequent problem that is in terms of cancer, but cancer making the liver enlarged is not a common cause, but the real common cause is the liver diseases, common liver diseases that we'll be looking at very shortly. Another situation, or what happens when you have enlarged liver, is that your heart may be coming down. You may have problem with the heart health. A heart disease may have started, or it may have gone forward. And another thing is the blood vessels. Maybe the veins, something is blocking the veins, so that can also lead to this enlarged liver. And then also an infection. It means infection or toxin poisoning. Toxin poison, maybe something very toxic has gotten into your body, and that can cause the liver also to enlarge. But now at this point, let's have a look at the symptoms and signs of enlarged liver. But before I give you the signs and symptoms, let me put a number on the platform. You may have this problem in the form of liver problem, if it is hepatitis or liver cirrhosis, or if you have enlarged liver or any other chronic problems like heart diseases, diabetes, skin problems, fertility problems, fibroids, whatever chronic diseases that you have, which is the 90% of a human problem, please reach out to me through this number. It may not be you. It may be someone. Be a blessing to someone by sharing this number. And I tell you, God will also will give you that blessing you need. I'm telling you. The number calling outside the UK is +44 738 464 7300. Calling within the UK 0738 464 7300. This number is WhatsApp. You can WhatsApp me and we can talk, or you can, drop me a text message or audio message. I'll get back to you. I'll be very happy to discuss anything with you. And the good news is that there's a solution to any liver problem. I don't come here to talk about the disease and leave you. No. There's always solution, natural solution to the problem to reverse it. Not only to treat. Treatment is something. By reversing the problem for you to be healthy, to have a quality of health and quality of life is the purpose of this program. For you to be enlightened is the purpose. To have an eye opening is the purpose. Visit me also on the YouTube. Just get on the YouTube. Put in Dr. James Naturally. Dr. James Naturally, and subscribe. And there are a lot of presentations there that you could listen to and get yourself well educated on that. Practical information there, and share and be a blessing to someone. Now let's come to the symptoms and signs of enlarged liver. Let's take consideration of the following here. Now, put the symptoms together, and then you see that if an individual got it, then you know that it is enlarged liver. Now, jaundice is number one, yellowing of the skin and eyes. And if that individual may have muscle aches, muscles may be aching, fatigue, you feel tired all the time, and itching body, you feel nauseated, you feel nausea, and feel like vomiting, and then you have abdominal pain, and some in the abdomen there is quite hard. You have a mass, abdominal mass, especially on the right side. You press your abdomen and you feel that it is hard inside, within. Then you know that your liver is calling for you, is enlarged, right? When this disease moves forward, that individual may have swelling of the feet and legs, and that individual may have poor appetite, and then easy bruising, and the weight loss. You may be losing weight that you don't even understand. You eat the same amount of food, the same type of food, but you be losing weight, and you don't have any understanding about that. And there's also increasing abdominal size, so your abdomen will be growing big, and you wouldn't even understand. So these are really general common symptoms of enlarged liver. But the following symptoms, put them together, they are a matter of emergency. If you have severe abdominal pain, and you have fever and jaundice, and you have bloody or coffee ground vomit, you vomit, and the color is like coffee ground vomit or blood, and then you are short of breath, and your stool is black or tarry stool, like bright red blood in your stool. If you put all these symptoms together, severe abdominal pain, fever or jaundice, bloody or coffee ground vomit, shortness of breath, and the black tarry stools or bright red blood in your stool, it is a matter of emergency. It's a matter of emergency that you have to be rushed to the hospital to be attended to. But beloveds, why do you wait? Why do you even wait for all these symptoms? Because symptoms actually tell you that you've reached about the 5th level of disease development. It means 5 out of 6 of disease development. We have 6 levels. So why do you even wait for symptoms to come? That is why prevention is better than cure. Don't wait for the symptoms to even come first before you take, the right step for your health. Now, let's have a look. What are the causes? What are the causes of enlarged liver? Now, the common causes are liver diseases, like we call that liver cirrhosis. When you say liver cirrhosis, this is advanced damage and the liver tissue that is scarring, the scarring of liver tissue because of alcohol or because of some chemicals that have gotten into the body, and that can cause the liver tissue to scar. It's a very damaged stage of the liver. This can cause the liver to enlarge. It's quite common. And the non-alcoholic fatty liver disease is another common cause. When I say non-alcoholic liver disease, it means that people that drink a lot of sweet drinks, these soft drinks, the so-called juices, and too much carbohydrate, that can actually contribute to non-alcoholic fatty liver disease. Is becoming very common, even more common than alcoholic fatty liver disease. Alcoholic fatty liver disease is because of alcohol, but non-alcoholic fatty liver disease is not alcohol, is non-alcoholic stuff. It means the sweet drinks, the soft drinks, too much carbohydrate. We put too much carbohydrate in our system, especially individuals that we come from Africa. Our food is high carb. We have to have the wisdom in eating it. Small portion and more vegetables to balance it. That will be all right. That wouldn't cause any problem at all. But be mindful about the juices, the so-called juices, the sweet drinks. Be very, very mindful about that. When we move on, we see that there are other causes too, like toxic hepatitis. That is, your liver can be inflamed because of some toxins, obstruction of gallbladder or bile duct. You see, the gallbladder, there's a duct, there's a canal that the liver produces bile to get stored in the gallbladder. But if this duct is obstructed, if something blocks it and doesn't allow this bile to get to store in the gallbladder, it can enlarge the liver as well. There are also non-cancerous liver tumors. Non-cancerous, they are not cancerous. They are there. They can also make the liver also fat. There are also fluid-filled pockets in the liver. We call them liver cysts. It can also contribute to that. But liver cyst is not too common, cause of liver enlargement. There's also a disorder like a fatty substance that can accumulate in your liver. It's also there, but it's not too common there. And there's also accumulation of iron or accumulation of copper, accumulation of protein. They are all disorders, but these accumulations of these substances are not too common, but they do exist. But what is really common cause of this really is the liver diseases. The cancers actually are also there, but they are less common. They are less common to enlarge the liver. Cancers like leukemia or liver cancer or lymphoma, they are there, but they are not too common to enlarge the liver. What is really common is that non-alcoholic fatty liver disease, liver cirrhosis, alcoholic fatty liver disease that is due to alcohol, and the health itself of the liver that can lead to obstruction of gallbladder and bile duct. Also, toxic hepatitis, and hepatitis itself can lead to this problem, that is enlarged liver. Now, if we look at it, another cause that is quite common is a blockage of the veins that drains the liver. That is hepatic veins. If there's a blockade or blockage of the veins, it can also cause this enlargement of the liver. But more importantly, one cause that you have to take note of is heart failure, heart disease. If the heart is failing, that it can't pump well, then of course it can lead to enlargement of the liver. You see, so when an individual got the liver enlarged, it can mean that the person got serious underlying problem like heart problem. Heart problem. Let's look at the risk factors. Who gets actually enlarged liver? Now, those individuals that may have some genetic disposition, that is autoimmune disorders, inflammatory bowel diseases, chronic liver diseases in the family. But I'm telling you here, the truth of the matter is that it's only 3-5% probability. But all depends on your lifestyle. Lifestyle is 95% of the problem. So it means your lifestyle is everything, especially about nutrition, what you eat and what you drink. That is it. And how often you purify your internal organ system. That is it. So your lifestyle, if you have a good lifestyle, you will avoid liver problems for the rest of your life. There are other causes like excessive alcohol consumption. It's a lifestyle. The people drink too much alcohol. In fact, if you look at it, that causes a lot of problems. But there are other problems that you may not see it to be a problem. That is tattoos. Tattoos have become fashion. You see individuals with tattoos all over their body. It's a risk factor for liver problems. Tattoos. And the blood transfusion. You have to be careful what kind of blood is given to you. If there's a problem, you are rushed to the hospital, you have to be careful. And then, of course, unprotected sex. It means that those individuals, listen to me, if you are married, stick to your partner. And you don't have to protect yourself because your partner is there, is faithful to you, you don't have problem. Right. Hepatitis A, B, and C. They are also risk factors. So if you have hepatitis is not a good thing. But the good news is that you can reverse this condition. In the hospital, they will say there is no solution. But there's a solution to reverse hepatitis. If you don't reverse it, it leads to more serious problems like liver cirrhosis and liver cancers. Right. But hepatitis can lead to enlarged liver. Right. So if you look at it critically, if you have a poor eating habit and you are overweight, it's really a huge risk factor, a factor for enlargement of the liver. Today, lovely listeners, we've had our eyes open to liver health, enlargement of the liver. And we know that enlarged liver itself is not a disease, but is a symptom of serious underlying problem. And mostly we can see that is a liver disease, by liver cirrhosis, or non-alcoholic fatty liver disease, or alcoholic fatty liver disease, or the health of the liver itself is going down. It's the most common, and there are other serious ones too, like heart problems. Your heart may be failing. Congestive heart disease is also a risk factor for enlarged liver. So when your liver is enlarged, you know that there's something really behind it. So itself is not a disease, but it is a sign that something is seriously wrong. Our eyes of understanding, I believe, has been opened today. And as we started with this topic, liver is the organ that gives our quality of health, which will translate into quality of life. If you need help to purify your liver, we have a beautiful liver pack that will actually purify your liver, will support your liver, and we have therapies to add to that your liver will be in good shape, so that your immune system, your whole life, apart from your heart, the liver is the second most important organ. Take care of it. Be conscious this year than never before, because we have challenges of these viruses. Your immune system should be strong. Your liver will play a huge role here. Thanks a lot for listening to me today, being part of this program, be on this platform. I look forward to having you around again next Sunday with a brand new topic. Thank you very much. God bless you.